All right. Yay. Okay, we're off and running here. So today is going to cover a few items about aging and vision. It changes above and beyond as we age. And yeah, I put a few questions there. How is your vision at this point? And how's your driving in the dark? Uh, how close do you have to get to the screen to see something? Yeah, my vision has not changed significantly. My driving in the dark is not what it used to be. And I have to get closer to the screen sometimes to see something. So I don't know if any of you out there can answer those questions or have a problem that way, but we're going to talk today about a few changes that mostly naturally occur as we age, as far as vision goes. So yeah, the assumption is, oh, we become blind as a bat. At least that's how younger people might think, or at least that's one of those assumptions that has been proven wrong. So I say not necessarily, but there are changes that occur as we age. And I was kind of blown away by how soon some of those ages can occur or start occurring, which some of them, unless you inherited a disorder, some of these age-related changes occur in your early 30s. So I thought, wow, a lot of these have kind of an onset that was earlier than I thought. I always assumed that, well, okay, maybe 40s. That's when I started to need bifocals. I've worn glasses since I was in my 20s, when I literally couldn't see the chalkboard, or I literally, yeah, I was early 20s at Sac State. I literally couldn't see the chalkboard. Then I got glasses, and voila, I could see things. Um, but yeah, I think the first thing is we start to lose our up close vision, which is also known as farsightedness. It's just the opposite. You can see things really crisp and clear close, but things in a distance, that's nearsightedness. So it sounds kind of weird, but that's that's how those are defined. Um, and I think too, we have changes in how we can see and distinguish colors um, as we age as well, because we have these receptor cells in the back of our eyes called rods and cones. Cones pick up color. Rods deal more with black and white. And we start losing both, but we start losing, it becomes more significant when we lose the ones that can pick up color and distinguish color, because there's fewer of those cells to begin with. But we start losing a lot of the black and white cells, the rods, soon, and that affects our night vision. In other words, if you turn the lights out and everything goes black and there's no kind of way to distinguish things, it might be an indication that you have a very, very low light problem. Yes, yes. And one of the suggestions is maybe put your high beams on, provided there's no cars coming from the other direction. Or get your headlights checked, cleaned, et cetera, or get your eyes checked, that kind of thing. I have a pair of glasses that have yellow lenses, and they cut the glare at night. Yes, and that's key too. What kind of lenses do you have that might help you drive or look at items on a screen like a computer? They do make those, and those are helpful. Those are very helpful, whether at night in that case, or whether or not you're looking at a screen all day, or at least part of the day. And I have a pair of glasses that my ophthalmologist made for me that makes it quite easier so that I don't suffer from so much eye strain. Because that's been a problem in the past too. Um, so yeah, the little picture on the right shows all the other changes outwardly in contrast to the changes what's going on inside the eye. You know, you can see the what looks like crow's feet, wrinkled skin on the lower lid, eyebrows that are lower and maybe falling and covering the eye, drooping upper eyelid. Yeah, all the outward appearances of, you know, aging, maybe. Okay, so hopefully nobody out there on Zoom land's having any trouble seeing this. Ha ha ha. Um, so what are some of the most common age-related problems that we deal with? And we do. The first one I'm just going to talk briefly about. Actually, I'm just going to hit briefly on each one of these. The presbyopia, which literally means old eye, your eyes are aging. Glaucoma is that eye exam you get if you get an annual or biannual eye checkup to examine your eyes for increased pressure, because that's a big deal. And it tends to affect a lot of people as they age, even if they don't have diabetes. Dry eyes, a lot of us have that and maybe don't think much about it, except when it feels like somebody threw sand in your face, but that actually didn't happen. It's just you're not making as much tears, perhaps. And then the macular degeneration, the age-related. So I think you'll find on one slide, I put it in reverse. I referred to it as ARMD because that's more or less how it's referred to in some of the literature, age-related macular degeneration. And then, of course, cataracts. That'll be probably one of the last ones I'll cover today. So before we get there, self-regulating in eyesight as we age, driving a car at night, I am finding it difficult early in the morning or at night driving. Uh, it's it's just that, you know, seeing around this corner or seeing ahead of me or to the right or the left in general is a little bit more difficult. Sometimes I put the beams on. I try to avoid that. Sometimes I drive just slightly under the speed limit as well, so that if I have to react, I can have a better chance of reacting before something happens. But a statistic here from the National Security Council is that, well, driving at night, even for the best driver, is a challenge. But at least half of our accidents occur at night with people night driving, whether it's older or younger. I think it's a good idea, this idea of self-regulating. In other words, gee, I got a cutoff line here. I'm not going to drive after 7 p.m. during certain times of the year because it gets darker sooner, and it's just not as safe. It's for me, or if I'm driving anyone, it's just not as safe. So some people do that, you know, maybe for some people it's 6 or 5 rather than 7. I you know yourself, basically. You know yourself and what time of day or night, you know, you just don't want to venture out behind the wheel of a car. For me, it's a safety choice. So anyways, some of you may make that same kind of choice to limit your driving that way. So, yeah.
I found too that twilight is really kind of tricky.
It is tricky.
When I was much younger, somebody pulled right in, didn't see me coming.
Yes.
But they didn't see me.
You know, twilight is interesting. I observe other drivers at that point in time, some with their lights on, some with no lights on, not even, you know, bumper lights. And I just wonder, you know, I put the lights on when I get to that time of day. But you're right, that transition time. I wonder if anyone's actually studied that. How many accidents occur at that transition between daytime and nighttime? Because I think you have something there. I think you do. Because I oftentimes see half the traffic without lights, half the traffic with lights. And if you're one trying to blend from or make a turn onto, you know, the street or boulevard, you know, are you sure you can be seen? Can they see you? Do you have lights on? You know, uh, what do you call them? Reflectors, etc. Do you have lights lit up on the side of your car so they can see it's a vehicle trying to blend? So hadn't thought about that, but yeah, that is likely a dangerous period too. Um, yeah, and I oftentimes have to drive in twilight. Don't like it.
Driving home from work.
Yes. Yep. And just automatically, okay, this is starting to look dark, on go the lights. For my safety and anyone around me. So, you know, I referred to this before earlier, but when we're born, we have a couple different types of photoreceptors or cells, and they're located in the back of the eye. Again, they're rods and cones. And daylight, we're usually using the cones because we can see color and brightness and sharpness. And that's how we pick up, you know, under normal conditions, that's how we see things and pick things up. But with the onset of night, there's a mixture, kind of that twilight thing. There's a mixture of the use of those photoreceptors until it gets dark and there's low light. And then the other receptors go into play, the rods, to help you distinguish light from dark objects in the dark or when the light is very low outside. And unfortunately, as we age, we lose both types of cells. Just naturally, they just don't regenerate. So this is kind of a image of where concentration of some of these receptor cells are and how light goes in first through the cornea and through the pupil, which is, you know, attached to the iris, and then finally through the lens to pass through, for light to pass through to get to the retina and the photoreceptors at the back of your eyeballs. And that's where the optic nerve is located too. Very important because what you pick up with your eyes goes to the part of the brain that's hooked up. So the old eye, presbyopia, that is also very much age related, as the term would, you know, tell you. And it's a farsightedness that goes with that. And that has to do with changes actually with the lens of the eye. Now, you know, I think when I thought about that, I'm looking at my own lenses and I have to see through these. And what happens when my lenses get either dirty, foggy, smeared, whatever, I don't see as well through them. They get scratched. Well, even though these can't, you know, expand and contract and bend, our lens accommodates for light. And normally it actually measures that light to the back of the eye where it should, so you can pick up objects. But unfortunately, it was as we age, the lens becomes hardened. And that's due to some of the, I guess there's some proteins, and the makeup of the lens itself starts to harden, and that's sometimes due to those proteins that are deposited and contribute to the hardening of the lens. So it's not accommodating as much anymore. It just kind of stays stiff. And that's why, objects appear blurry instead of hitting square on the back of your eyes. And in some cases, that's why corrective lenses will do the job, or contact lenses. It'll correct that problem. Okay.
So Rob,
Yeah.
so if I understood you correctly, so like when the lens to my glasses are smudgy, that my eyes is also intensifying that then, so it's not just my.
Well,
or-
if you have existing problems, I think that it's Paul, right? Yeah, it's Paul.
Oh, sorry, yeah.
I just kind of liken problems in the lens of our eyes to, maybe problems with the glasses. And I think of, well, what if your prescription needs to change?
Okay. I thought maybe the coating.
Or what if your glasses, for lack of a better way of putting it, are just foggy all the time. And, during COVID, of course, my glasses got fogged up all the time because of my breath leaking through small apertures. And I would constantly have to clear that out before putting the glasses back on so I could see. Which isn't quite the same as hardening of the lens, but I have a better appreciation of the lens within the eye now, thinking of it in different ways, in relationship to my glasses, or in relationship. I'm thinking of cataracts in this case, and we'll get to it. But you know how your headlights, as time goes on, that those plastic domes become, well, opaque, and light doesn't come out of them very easily anymore until they're treated or replaced. And then, of course, light comes out of them very clearly. I'm thinking, well, that's kind of like cataracts. Light doesn't come in very easily. It looks, more hazy or scattered until that lens piece is replaced. And then it allows light to come in. So I was looking for, different things in the environment to compare that to. But that's right around 40. And if I remember right, that's when I started to need bifocals. So it makes sense to me that the onset of this condition starts in the early 40s and peaks around the mid 60s. But at least according to one source, near 100% of us have to deal with this after the age of 40, in one form or another. So, normal vision, you can see how the light in the first shot gets picked up on the back of the eye where it should, because that's where the retina is. But presbyopia, which is basically another term for hyperopia, is where the lens is not able to accommodate so well. And instead of seeing that clear object where it hits the retina, that object becomes blurry at that point. And that's why also the focus point is beyond the position of where your retina is for your eyes. It's an interesting diagram of that. I thought that's why I included it.
I'll
Uh-oh.
raise his hand.
Oh, who did Paul? Yeah. Paul? Or was that your hand from the last one?
Oh, I'm sorry. I forgot to lower it. Sorry.
No, no worries. It was brought to my attention because my peripheral vision didn't pick it up. Anyway. So that's presbyopia. I mean, we're all going to deal with it from one degree or another. Well, some might have a little bit more severe than others. So it's to a degree. Glaucoma, that's the big thing. That's the big thing. Yes, and this is one of the leading causes of blindness, glaucoma, the pressure buildup in the eyes, because the fluid inside the eyes doesn't have a way to escape and get reabsorbed. It just stays in there and builds up and damages nerves and blood vessels in the back of the eye eventually. It can occur at any age if you're diabetic. That would make sense. That would make sense. But it's also pretty common in older adults, whether you have diabetes or not. And I think mainly because of just the aging of the eye and maybe high blood pressure as well. Yeah, leading cause of blindness in those of us over 60. So it's a big concern. It's a very big concern. And what I thought, after reading a little more detail about it and choosing what I could put in this presentation, is that you may have it and really not know it. And the only way you could have it, maybe, even if you have no signs or symptoms, but finally know it, is if you go to the ophthalmologist and they test you for eye pressures. Then you'll know, because when I went for my eye exam, and incidentally, what prompted my interest in this topic in the first place is I had to go to the DMV several weeks ago because they wanted me to come in person to get a new picture, a new thumbprint, and then to test my eyesight. So it prompted this, and I got a text message from Linda, and I said, "Hey, how about eyesight?" Because I told her, I said, "I'm here at the DMV waiting for my turn to get to the Snellen chart so they can check my eyesight." So I thought, how appropriate. I think I'll do that. So if you're not getting checked out regularly, these early signs and symptoms perhaps are subtle, and you may not pick it up at all, but some of the later signs when it comes to like changes in vision, might lead to some irreversible problems, but maybe if you catch it, you can manage it. That's the word I'll use, manage it. The best way is to keep on top of it with your annual exams or whatever you have worked out with your ophthalmologist. For me, it's an annual exam complete.
UC Davis just opened that new eye center.
I saw that. Yes. Yes.
I'm sorry. I couldn't hear.
Oh, I'm sorry. That's Kevin mentioning the new eye center at UC Davis, the Med Center. And that's where he had his cataract surgery. That's just, FYI. I saw that going in and out through the ACC building over there. So I wondered about that. I thought, wow, they have a new center for ophthalmology and eye procedures. That's cool. They've needed that for a long time, from what I've heard.
It's really nice.
Excellent. And that's where you had it done. Awesome. So yeah, this is why eye exams are so important. I used to dread them, but now I've accepted the fact that my eyes are getting older, and any little thing that happens to them that changes vision or this or that, I recognize and I want to address if it's anything I need to be concerned about. So,
Be proactive, taking care of your eyes, because you want to address it before it becomes consistent.
absolutely. Kevin just mentioned that being proactive is a very important part. And actually, being proactive might include, getting certain vitamins like vitamin A, even though it's not going to boom, your eyes are back to like they were when you were a teenager. No, but the vitamin is a part of managing, healthy eyesight and your eyes in general. So is vitamin C and zinc. There are supplements out there, but I asked my ophthalmologist about those one day, and he told me, he says, no, you don't need them. Do you take a multivitamin? And I said, yeah. You don't need the others. You don't need the others. He said, for you, it'd be a waste of money. They're quite expensive anyway. So, but then omega-3s have been shown to have a very positive effect too. Green vegetables. I read this in different pieces of literature online. The omega-3s appeared in almost all of them. So I thought I'd mention that as part of your diet, inclusive as part of your diet.
Linda was here, she was telling you to eat more vegetables.
Yeah, absolutely. I agree. Long story short. So this normally here, okay, the fluid that backs up is called aqueous humor, and normally it gets recycled. But in the case of glaucoma, that recycling mechanism is blocked, and it ends up damaging blood vessels, and especially nerves that lead to the optic nerve, which is one of the 12 cranial nerves. As a neurology nurse, we were always concerned about. And that's where the damage is done and can lead to blindness. So important to get follow-up on all of these conditions.
Do they have surgery for that? I mean, to create drainage?
Yeah,
They can, yes. I didn't really include that, but they can. That's a different kind of intervention. I mean, they have eye drops that help manage glaucoma, depending on the type of glaucoma. That will, dictate which type of eye drop that you use to manage it. I mean, managing it with eye drops is what I've seen most normal on any one nursing unit. A patient comes in and they have glaucoma, you expect to see maybe one or two of, different eye drops for glaucoma, and sure enough, they're there, and I give it to them to administer because they know exactly where they put it. So, but yes, there are procedures, and hopefully, I don't know the statistics on how the turnout is after that, but it works to relieve the pressure. I don't know how long-term it is though, Paul. I don't know the long-term results. So that's a good question though. And there is, I mean, that brings up a good point. If
they can push it out 10 to 15 years on someone our age.
That's great.
Probably.
I didn't hear.
Poke away.
I didn't hear.
My father-in-law, they used a laser, punched a hole in the back of his eye with the laser to relieve the pressure.
Now that's amazing that the technology, they can use a laser to do that and really pinpoint exactly where they want to put it and not damage some other part of the eye in the process, which blows my mind, literally. The advances that have been made. Yeah. Then you don't need to worry about glaucoma anymore, period. Oh, So Kevin was mentioning about new techniques, a laser technique to pinpoint where the hole should go. And just as a funny note, he says, yeah, you don't want that to get, you don't want that laser to be on high beam. So, yeah, 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 that's something like sci-fi. Oof, blew my mind. So the next thing, this is what I have a lot of trouble with, and I've tried Restasis as a way of treating it. I tried another drug out there too, quite expensive, for treating dry eye. Dry eye often occurs because of autoimmune response that, along with plugging of those glands that create tears, there's also a somewhat of a dying away of those glands as well. And sometimes you can unplug those glands, but it's like a procedure that you have to have done in a surgical procedure room. But most of the time, people treat dry eye, and some people have dry eye and they don't know it. They just think it's, well, it's just my eyes. But if you don't treat this in some way or another, you could do damage to the cornea if they get super duper dry. Most of you probably had symptoms of this and maybe not know it, like someone threw sand in your eyes, or your eyes are painful for some reason. Well, it's because your eyes are extremely dry because you don't have the normal tears that lubricate the eye. And usually, typically, that goes along with a film of oil that keeps that lubricant on the eye. And if those glands are blocked, tears and the lubricant, or I want to say the part of it, the layer, it's like a lipid layer that keeps that, the tears, natural tears from your own eyes over the eye. Yeah,
I medicate my eyes at night with the Genteel.
that's a good idea.
I may not do it every single night, but most nights I do, because it soothes my eyes as I sleep. And then when I wake up in the morning, I don't have that, but
Yes.
quite a big problem.
Oh, I forgot your name again. Judy just mentioned the use of an ointment that can be placed over the eyes along the eyelid just prior to going to sleep, so that when you wake up, you don't feel like you need a set of pliers to pull your eyelid up and down.
Right.
Yeah, and you can actually, that's safest to do, is to drop it. And then, right, absolutely, absolutely. So that's a good idea. I sometimes do that myself. Usually I use tears, natural tears, but they don't stay during the night, of course, and I wake up in the morning and
Gel is pretty stable.
yeah, the gel is pretty stable. I probably need to go back to that, Judy. So that's a good suggestion. It's a lubricant, so it stays there. It has staying power, as where eye drops probably don't. They might help during the day, and that's why I usually carry a small bottle with me. So, I mean, you could get this red-eyed, painful eye, gritty eye, burning eyes, stinging eyes from dry eye syndrome. My wife looks at me sometimes says, you look like you've been up all night long, but obviously you haven't, and your eyes are all red. And the doctor prescribed a very mild steroid to decrease that inflammatory response that sometimes occurs on the white of my eyes. I don't use it often, and I don't use it often, thank God, because I know that the overuse of steroids in the eyes could lead to other problems later on. So I only use it as a rescue type of eye drop. but it's a very common problem. This is probably the most common problem that we get as we age.
Another problem that I've had personally because of dry eye syndrome is that there's a cushion in the back of the eye that has fluid in it, and when it dries up as well,
Yes,
what happened to me was that my eye pulled away from that because the cushion wasn't there, and the whole eye pulled away from it. It wasn't called a detached retina.
No.
It had nothing to do with
Ah.
retina. But however, it's very common, and it is quite frightening when it happens.
yes.
Right back into place, and I've never had it again, and I hope I never do.
Thank goodness. Thank God. Yeah, Judy just mentioned a condition yeah, I don't either, but it seems I've heard of that too. It's not a detached retina, but it is a form of detachment that occurs sometimes in people who have severely dry eyes. And Judy mentioned that it only happened once, and it hasn't happened one time only. So it sounds to me like that's a rarer effect, or I want to say a rarer consequence, perhaps.
But but, you know,
So here are some symptoms too, just kind of lined up. Blurriness is a problem. I have experienced nearly all of those symptoms on the screen, and I'm tempted to scratch my eyes, and I have to hold my hands away because I don't want to do that. That's just going to contribute to irritation, as I've learned from past experience. And I have really severe allergies that affect my eyes as well, and probably contributes to a lot of my red eye problem. And so I take Pataday once a day. I was on Restasis, and I only got Restasis is supposed to, you know, it's supposed to blunt the immune response that's occurring and hopefully restore. And a lot of people, you know, the natural processes again with the tear ducts, and the fatty layer lipid film that keeps those tears there instead of simply evaporating away. So some people have a really good experience with Restasis. It was suggested to me after I got it from a fellow nurse who used it. Keep it in your refrigerator. It stings less going in if it's cold. So I did that, and she was right. She was right. So this is common, very common. Macular degeneration. Now, Dave and I talked about this morning because he has macular degeneration. I think he mentioned that he's had it now for roughly 20 years. He's been able to manage it, I think, with medications. He didn't go into detail. But what happens is there's a spot on the back of the eye on the retina called the macula, and it begins to deteriorate in this condition. And as a consequence, your ability to, well, your centralized vision that we have begins to become somewhat distorted and not nearly as sharp as it once was under normal conditions. So the macula is very important for, you know, at least one fact, that it allows for us to see things in sharp and fine vision. In fact, when I was going through grad school, I had to take a course in, I had to take an NP course in physical assessment. And it's very akin to what doctors do in a physical assessment. So I had to use the ophthalmoscope as well as using the otoscope to look at the ears. So I had to identify objects, including the macula in the back of the eye, which for me kind of blew me away because normally nurses don't do that, but NPs can use that device to look at the back of the eye. So it's, for me, it was like looking with the otoscope at the eardrum for the first time, and how I got blown away by that, because normally as nurses, we don't go that far. But the macula, getting back to that, I'm sorry, I went down a trail. It destroys our centralized vision. And this does happen with aging, it can happen with other age-related illnesses. But what I found interesting about this is there's a couple of different, I mean, macular degeneration can be a dry type or a wet type. And the dry type is the most common. The wet type is the least common, but responds, if identified, it responds to surgical procedures. And the dry type is the one that is a little, you can manage it, but there's no quick fix to it. There's no quick fix. In other words, there's no real surgical procedure developed yet that's a quick fix. And what Dave told me too, and it turns out to be exactly what I knew, but from what I researched, is that if you have the dry version, it could turn into the wet version. And I thought, well, I better not go into that. But knowing that's a thing, you do definitely want your doctor to dilate your eyes during an exam to see in the back of the eye what's going on. And so with every eye exam, having them either dilate or doing either what they have, a corneal scan or a retinal scan, pardon me, retinal scan, which insurance tends to not want to really pay for. So most of the time, I think it's out of pocket. I paid for last exam, I paid for the retinal scan, and the doctor dilated my pupils anyway because he wanted to look, which I'm glad he did. He didn't, I was very relieved that he didn't notice any changes and nothing new going on. So yeah, with each eye exam, I get a little relieved if he doesn't have anything remarkable to say. Yes.
Talking about dilating the eyes, the last time I went in was at the eye center. And it burned,
Yes, it does.
and it stayed burning for another 6 hours afterwards.
That's unusual. That's
Yeah.
unusual.
It also had, of course, distorts your vision, so that
Yes.
it's.
Kind
Yeah,
of.
did it advise a driver to come with you?
Well, gosh, I used to go away from my doctor's office with the shades that you can put on in front of your eyes, in between your eyes and your glasses, because you tend to be more sensitive to light. Because dilating the pupil means your pupil is a lot bigger, and it is going to change your vision as far as allowing light in. And that's why they basically, they have at my doctor's office, they have a basket full of these for you to pick up on your way out. If anticipating you're having a full exam. Yeah, I imagine I'll have to ask my doc about that. Usually it stings, but only for moments. That's the usual course. Now, why your eyes stung for so long afterward? That's a good question for your ophthalmologist. It may end actually be part of the normal, but I don't know. Maybe the stinging lasts for an hour. For me, it just lasts moments to a few minutes and then it's gone. And he always warns me before he puts it in. So,
Well, the response was that, oh, well, you must have dry eyes. But then there was no replacement of the eyes. There were no eye drops made available.
Oh, I see
Now
what you
the
mean.
Superworks
I see what you
give
mean.
the eye prescribed.
Right, right. I have tried to solve that problem by being ready right away, but with my own coverage on that. But the doctor is very ready and willing to hand out samples. And I asked him, hey, do you have any samples of, this or this? He says, sure. They get tons of samples of different eye drops, especially the drops that are natural tears, the best ones, especially. So he's always willing to, say yes and send me away with some of those too, which I appreciate. But yeah, I imagine people with dry eye, it probably will sting more and maybe a little longer too. That would be something one would have to research to see, if they have this condition. I think it's atropine is the name. They have it in a little bottle is what they drop in there I think that's what they do. What the numbers are for individuals with dry eye, does it tend to irritate longer after they put it into dilated pupils?
I never had that problem. I always used to just go to Costco and have.
Yeah. Oh, sure, sure.
But this was just caught me by surprise.
Yeah, yeah. Well, next time you have them dilated, let them know, hey, this lasted for several hours. That doesn't seem normal. Yeah. So bring that up. I would. So this is just another picture of, what the normal macula looks like in the back of the eye, which we had to identify where it was. And then what form maybe the wet type or the dry type, because they look different in the back of the eye. And the only way one could actually distinguish one from the other is to see several shots of one and the other and make the comparison. But I thought I'd put this slide up there to kind of illustrate the difference in what they might look like if you were looking with an ophthalmoscope. Cataracts. Now, Kevin just had his cataract surgery, and that's why another reason why he brought up, that's where he had the surgery in the new eye center. And I imagine your vision has improved immensely.
Yeah, I only did one eye, but it's 2015 in this one. So,
Wow. Okay. Kevin said they did one of his eyes and his eyesight improved immensely to 2015, which is awesome.
it never was that good.
Yeah.
Or even 20.
No, it was never.
They break up the lens with a laser, and then they extract it, and then they put in a new artificial lens. And you can get several different types. Some correct in astigmatism, some are for just short distance, and some are for all three. But you have to have your eye a certain condition in order to take the ones. And so the doctor felt that the one that gave me distance was better, and she said, don't put the multifocal in, which I was kind of hoping to put in my reading glasses. That ain't happening.
That ain't happening.
And then because my left eye was not as bad, Medicare won't pay for the left eye until it gets worse than to do it. But now I've got a race between my doctor that did it is retiring this year, so if I don't get it, then I'll have to find another or wind up with a different doctor.
Kevin is relating, what they did to restore, really good vision to his right eye. And, why they put the lens that they put in there versus another kind of lens, which he could have opted for maybe, but his physician said that's probably not, you should probably go with this. And he is also talking about having the other eye done But as insurance goes, they won't do Medicare goes, they won't do the other eye until it gets to a point where it's, so bad that, then it's deemed to be more of a problem, I guess. And, well, that's Medicare for you.
Yeah.
So,
I went in thinking they would do both eyes, but, no, they treat them individually.
I hope you had no complications with
No.
that. So Kevin said he didn't have any complications coming from that. Yes,
Where it says where cataracts are insidiously slow, and that's what I'm experiencing. I've had it for years and years. But they won't pay for it, but I still have the blurry vision.
you still have the blurry, I'm sorry, your name, pardon?
Patricia.
Oh, I'm sorry. Patricia says she's been dealing with cataracts for quite a while. And she has also run up against the same, the same answer. They won't cover the surgery on the eye until they get to a certain,
Number 3 or something.
yeah, a certain point where, your vision is so obscured that, okay, you've reached that point, now we'll do something about it. So, yeah, this is a thing that's quite common. My older brother had his cataracts fixed one at a time. My grandfather had cataracts, so did my other grandfather. I think my grandmother did too. I'm pretty sure my mom, no, I don't know. I'm not sure about my mom, but I know my grandfathers both did, and my grandmother on my mom's side. So this is a product of, an eye lens that's very old. That's not true. Sorry, that came out awful. It's just, God,
Resemble that more.
sorry. I take that back. Blah, blah, blah. It's just a process of aging. I remember talking to my older brother about it, and about how his vision was changing over time, and why he was getting the cataract surgery, and how his vision changed for the better after the surgery. So, this is a normal part of aging. This is a normal part. So really, if you look at it from the normal point of view on the left in this shot, sharp objects or eyesight, I should say, the light goes right where it needs to go in the back of the eye. But with a clouded, damaged lens, thickened maybe too, light gets scattered rather than focused like we're used to. So objects maybe not be so clear and crisp. And I know in the case of my brother too, he couldn't drive at night anymore. He just couldn't do it until he had the cataract surgeries done. Just no driving at night at all.
Yeah,
I don't-
got me to the dentist, because I've got that eye doctor. Was I went to a part of Sacramento I was not familiar with, and it was at night and it was raining. That was scary. I mean, I couldn't hardly see at all.
Yeah. I imagine it's not just the cloudiness and blurriness maybe, but
Well,
yeah, putting a whole bunch of that together.
So I came up to an intersection which had just replaced the signal lights with LED lights, and they're brighter.
Ah, okay.
And so all the lights were red, but the bright red kind of washed out in the vision for everything else. And then you had the cars coming this way, and then I'm like,
Right. And I know I've heard that that's what it does with light. It just kind of gives it a halo-ish, diffuses it. And that's kind of what's going on in this other shot. This light is diffused, and
so the LED lights look brighter. So,
I wonder how much bright lights versus the older,
well, the reason is they're not like bulbs. They last
that's the
forever.
wrong word, but the alternative that they replaced. It's a matter of the light bulb or just the light bulb in that case.
Well, the bulbs burn out faster, so that there's less maintenance with LEDs.
You know, that makes sense. They last longer. Okay. Well, all right. So this would definitely affect your driving at night. In a big way. So what, at least here are some approaches that seem universal from the literature, is to get an annual appointment with your ophthalmologist, your eye doctor. Even optometrists are allowed to do certain or dilate the eyes, order certain medications, procedures, versus the ophthalmologist can do the surgeries on the eyes as well as, so they have different scope of practice, optometrist versus ophthalmologist. But in any case, you know, that annual checkup is a maintenance thing you should be doing regardless. And, you know, that's where you find out, do my lenses need to be changed? Is there a change in my eyes? Does a medication need to be added? Oh, all of a sudden pressure in the eye is, you know, such a point. I may need to be on blood pressure medications or some other medication that I can put topically over the eye to help reduce pressure in the eye. And the only way you might know that is to go see your doctor to follow up on those things. And then knowing your limits, when you could go out and drive. I mean, it's a little different, I suppose, if you were out walking, but if you're out driving or something like that, and you're unsure, if you're unsure, you probably shouldn't be driving, but in some cases, people don't have any choice. They just try to be as careful as possible. Maybe there's no other alternative. So the idea of using your brights, I can see that as being a good thing, provided you're not on a road where there's a lot of traffic coming your way and you blind the person coming in the other direction. who won't take kindly to that, maybe. So I can see that as being useful. I pulled that idea from the latest AARP magazine where they talked about night vision and driving at night. And what are some ways you might approach it? And of course, they had some very common sense things like if you're a smoker, quit smoking, eat a good diet. They put it out very vaguely. Now, smoking, yeah, I can understand why you'd want to quit that because that'll affect blood vessels in the eye as well as in the rest of the body. Which I mentioned next. Diabetes needs to be controlled well, managed well, and then quit smoking. Find some other means to get off the cigarette that is going to, benefit instead of staying on the cigarettes and increasing damage to your eyes. Not to mention what else it does. I put in, I read that cleaning up your headlights, if you're having trouble with your regular beams, high beams, low beams, and if you look at the headlights on your car and you notice you barely see the lights coming out of the lens, that maybe that ought to be cleaned up or replaced so that maybe it'll shine brighter in your environment. That's really all I'm getting at with that. Clear your windshield of debris. As if that isn't common sense enough, but some people drive with all kinds of crap on their windshield.
I had a question about that because windshield wipers, this is the time of year to change your windshield
Yes.
wipers, because they don't.
Yeah, I noticed mine were not keeping up the other day when it came down, when it was pouring.
Better to buy them now, because after the first, it really starts to get rainy, then the price.
Yeah, mysterious how, yeah, it's strange how that happens. They're hugely expensive.
Yeah.
Yeah,
I mean,
yeah.
Be able to buy them
Check
down
my
for
tires though.
$10.
Yes, they were very reasonable. They were very reasonable at one time. So, you know, as mentioned, healthy diet, omega-3s, exercise. I mean, they have a positive, those things have a positive impact everywhere in the body and you know, our entire system. So other than that, how do we accept changes in our eyesight gracefully? I don't know if there is a graceful way, but it's perfectly normal. You know, these eyesight, everybody says, you know, you're blind or something like that. Well, guess what? It's coming for you. As you get older, it's coming for you too. It's part of, you know, one of the senses that changes as we age. It just does. We can, you know, prevent some things and, you know, others we have to learn to adjust. Like I had to learn to adjust to glasses. I had to learn to adjust to that and realize that, God, you know, why am I wearing glasses so young? I thought my eyesight was great. You know, all of a sudden, you know, returning to school, college at the age of 20, I realized that, you know, I'm sitting closer and closer and closer to the board until I realize even when I'm sitting as close as I can't make out all the letters. And it was a chemistry class. And the professor came up to me and said, "Why are you squinting? You're right up." I said, "I can't see it." He says, "Well, you need to get glasses. You're right up front." And I said, "Yeah." I said, this is true. This is correct. Now I need to do something about it. Somebody else notices it right away." So, again, too, you know, taking your medications as prescribed is a good idea. Even if it's natural tear several times a day. You know, my ophthalmologist says, carry it with you, take it as often as you need every day. And so I think, you know, that's how I kind of want it. What, do you have a question?
Yeah.
I'm sorry, what is your name again?
Hi, Susan.
Susan. Yeah, sorry.
No, I'm just thinking about how these lights, this particular kind of light, really hard on the eyes.
Oh, it's fluorescent, right?
Yeah,
These are
guess,
fluorescent
yeah,
lights.
just, but it's interesting how, you know,
Yeah, I know. That's a different, you know, sources of light, like whatever different, you know, like Kevin mentioned with the traffic lights, changing it to a different kind of bulb or light source, will affect, you know, how you see, what you see, and how worn out your eyes might get from, you know, being in that kind of light. I used to, when I worked night shift, I used to be able to do a lot of things in the room without turning the lights on, which seems kind of spooky, I know, but I was pretty proficient at doing it without waking the patient up very much and turning the lights on. And
Well, I sure appreciate it.
yeah, oh yeah, yeah. I tended to do everything I needed to do almost in one shot and then leave them alone the rest of the night, which was good. They appreciated the sleep, and so did the doctor the next day. When they come on the patient and see the patient, you know, they might complain, "Why in the world are you waking my patient up 5 times a night? Why are you doing that?" You know, and that wasn't to me, but I caught the message right away. So I learned to do things in the dark. But that changes. That was when I was younger, when I did night shift. I did do things in the dark because I could see them better. I could literally see them better. I had glasses, but I could still see them better. Now, no way. Trip fault. Header. Subdural hematoma. Fracture. You just dislocated the hip you had corrected.
You trip on the cord that supplies oxygen to the.
Yeah, exactly. I avoided that. You know what? This is where a tiny pen light comes in handy. And so I would use that just in a small scope in a tiny area if I was unsure. It's not in the patient's eyes by any means. It's not even near them. And I only flick it on for a moment and then it's off. But I know the patients appreciated that. I said, look, I'm done. I won't bother you for the next 4 or 5 hours. Is that cool? Unless you wake up and tell me you need something. So,
You know, sleeping in a strange bed and a strange pillow and noises and whining and
yes.
have roommates who snore or watch TV late at night.
Well, right. Yeah. So I tried to do as little as I tried to go in as little as possible during the night and do everything all at once, which might sound like, hey, you're crowding the patient, but I think they appreciated it later on because when I did come in for other things, little things, simply creaked the door open, tiptoed in. If I needed a light on to check how far the drip had gone down during the night, I could do it with a pen light. So it worked. It worked. So any questions, stories, thoughts? I mean, there's been some good responses. I mean, to me, it's made me more acutely aware of my eyesight and the limits I think I have to begin placing on how late at night I can drive. My wife has the same trouble. And so we try not to get out and drive when it gets dark, unless we absolutely have to now. But the thing is, you know, I have to get up super early to get to a work site to teach. And so I'm up and I'm driving at 5 o'clock in the morning and it's still dark out. But the traffic is much different on a weekend, and there's nobody out or very few people out on the boulevards, and only a fraction of people out on the freeway at that time in the morning. Trucks, they're out all the time, but blending is not a problem because you have large gaps between you. And so I have found, at least in the early morning, that's not much of a problem. But at night, coming home, lights are down, changed. You got, you know, you're dealing with all these lights and coming in your direction, and I'm having trouble seeing. That now I realize I need to start limiting, you know, more, maybe more so, you know, how late at night I go out and drive. Anyway, any other thoughts in Zoom land? Any thoughts? No? Stories? You know, there's so many things. Yes?
Rob, do those, you know, sometimes on TV they advertise those tablets you can take. Do any faith in them or?
You know, I kind of take that with a grain of salt. After I talked to my ophthalmologist about the various supplements, he said, you know what? If your diet is good and you take a supplement of a multivitamin daily, and I told him simply yes, he said, you're covered. You're covered. You don't need to have explosive amounts of this vitamin or that vitamin in your system. He says that's just you don't need it. And so I don't know, Paul. I would say for me, from what I understood from my own encounter with my doctor, he says it's really not your eyes are not that bad, and if your diet is good, you don't need to worry about it. So I just look at that, and I've seen some of those commercials too. And I don't give them a second thought. Oh, yeah.
They have the commercials because there's big money in pharma.
Well, that's another thing too. That's another thing too. And they can advertise whatever they want, really.
Do you think, by the number of Viagra and Cialis commercials, do you think that most Americans are struggling with some sort of?
Why are they so concerned with
I
that?
don't know.
I don't know. It's a fixation.
It is.
Antacid.
Yeah, I see a lot of commercials for that too.
Every platform was covered with the purple pill for the stomach antacid.
Prilosec?
Ads in the financial business.
I think that's for good reason too. How appropriate.
No, but
Is lutein
Now, lutein
something that
is
you need to take?
now lutein is also one of those. Yes, that is an important. That's an important substance to include. Sorry, as soon as you brought that up, that keyed something in my brain. Yes. In fact, that's described with some of the others like vitamin A, C, zinc, omega-3s. Lutein is one of them too. Yes. And I'd say that is something you could include. Oh gosh.
Thank you.
I've never fully examined that, but it has been shown to have a positive effect on the eye, number one. And I guess it works in concert with other substances too, because it's included sometimes as a supplement, maybe not necessarily as a vitamin, but as a supplement. And I've read from various sources that, including omega-3s, which omega-3s have great benefit to the body in many other ways, not just to the eyes and blood vessels, the brain, etc. But that's included in I remember most of the articles I read only included maybe 4 or 5 substances that have any credibility on the eye. And lutein appeared in each one of those, and so did the omegas. So but a good diet. In the end, if you have a good diet, you don't need to have all these supplements, unless you have a problem with digestion and absorption. Then that, of course, is understandable. If you have a problem with digestion and vitamin absorption, mineral absorption, etc., then yes, it's understandable why you might need to supplement or get these important vitamins some other way, or minerals some other way. And that makes complete sense, because I've actually seen lutein included in multivitamins as well. So, but there's no reason to go out and bombard your system with all of these.
you just eliminate it in the excess. So you're just peeing out.
Yes, exactly. What your body doesn't use, it eliminates. It's just that you don't need to, you don't need to overdo it on this vitamin or that vitamin. So yeah, but lutein is important. Yes. Any other thoughts? With that, I guess I'll end. This is being recorded, so it should be on the site. Anyway, thanks. Good discussion.